Hello everyone, I'm presenting my DNP project on reducing medication prescribing errors at a facility where I presently work. I work as a family nurse practitioner in internal medicine for over 10 years now. I feel like this addresses a critical patient safety issue. So let me tell you what we've been seeing. Over the past year, we've had multiple medication errors happen in our clinic. Thankfully, none of them have been fatal. We've always called them, the patients always called us back, the pharmacies have called us, or once the physician or the nurse practitioner goes over the medication, sometimes we catch something that that a medical assistant may have put in wrong. So we do have several people checking it. However, there are incorrect doses being seen. Sometimes picking the wrong medication from drop-down menus can occur as well. Um, Not adjusting doses when someone has kidney or liver problems, and missing dangerous drug interactions. So we were trying to prevent real harm to our patients, higher costs, and people losing trust in us. That's especially tough in our rural community where folks already have a hard time getting health care. So what are we going to do about it? Well, we're looking at three approaches that research actually shows can work. Of course, technology, we've always had used technology already, but I think we may need to revamp it. So we're going to try to fix our alert system because right now providers are getting so many alerts that they just start ignoring them. I'm sure we may have all been guilty of that. Um, so we need to try to prevent that from happening. We're going to also make providers write down maybe why they're prescribing each medication. It creates a pause to think type situation. However, I know that's not feasible with every patient, so we definitely need to work on that one. Second, people were bringing in, maybe possibly bringing in pharmacists for help with really high dose medications and doing focused education on the exact types of errors we keep seeing at our clinic. The third process, creating a standard order set for common things like diabetes and hypertension. These have the right dosing and safety checks already built in, plus we'll give providers regular feedback. So what we would like to do is roll this out in phases so we don't overwhelm everyone. So phase one, we'll look at our current alerts and get rid of any unnecessary ones while making critical safety ones stronger. Of course, we're going to have to go through our EHR system for that. Phase two, start requiring the indication documentation and launch education programs regarding this. I feel like we need to educate our medical assistants, our providers, and our nurses regarding this era. And plus, another thing I've always tried to do is tell the patients to always bring their medications in with them each time they come in. That way we'll be aware of any changes. Also bring in order sets and pharmacist consultation. The key to making this work, getting buy-in from providers, keeping communication clear, just like I said, having them bring their medications in, monitoring how it's going, and celebrating the wins along the way. We do have signs up in our lobby and actually in our check-in room saying that please bring in all medications. However, I know this may be hard for some people, and I'm sure we've always heard someone say to us, well, I don't know what I need refills on. So they really expect us to know all that. And that can be hard, but it's ultimately we have to figure it out. But by the time they leave there, whether it's calling the pharmacy and get a medication list fax or just calling the pharmacy, and that's usually how it goes. And we try to have it fixed by the time the patient leaves. However, of course, there's always going to be errors, and that's what we're trying to correct. So what do we expect to see? Well, what we expect to see is fewer medication errors, safer care for our patients, less liability risk, and our community trusting us more. Our next steps are pretty straightforward. Get final approval from leadership, audit that alert system, start the education sessions, and kick off phase one and set up our monitoring. Bottom line, this is the right thing to do for our patients and our clinic. I really believe that with these proven strategies, we can make a difference in medication safety. I'll be happy to answer any questions for you. Have a good day and thank you.